Okay. Hi, it's Bill, the knee pain guru. Looks like we are struggling with some technical challenges. Let's see. You're not approved for LinkedIn Live. It's only available for a limited group of members. Click here. Okay, remove that. Remove. Save changes. Oh, okay, I think we're good now. Hi, it's Bill, the knee pain guru. Got a lot of questions today to talk about. If you have any questions, put those in the live comments. It looks like we just got rejected from LinkedIn, so no questions will be coming in from LinkedIn. However, we'll be rolling with the questions that were sent in through Facebook and YouTube over the past 24 hours-ish. We had some technical issues yesterday. We had to roll with it. Not a big deal. However, it's a good lesson because it's the same thing that happens with knee pain. You try something, it may not work, you roll with it, and then you figure out what does. And this is a common challenge I see with those trying to get over knee pain, relieve their knee pain, is that they try something, it doesn't work, or it doesn't work the way they think it's going to work, and they quit. It's a good lesson. Anyhow, okay, here we go. We have a question here. This was on YouTube channel. It's from Mary Denise. It says, if I understand your video, a person who has surgeries has scar tissue in these locations. May or may not. Person may or may not develop scar tissue after a surgery. It depends on different factors. However, we'll continue with what she says. Concentrating on these areas around the knee, there is scar tissue on top and the sides of the knee and, of course, behind the knee. I went up a ladder today, and on each rung, I was lifting my knee out of its comfort zone. Yes, that's what happens. Swelling happens in the knee. Scar tissue may happen in the knee. So what ends up happening is the body needs to compensate. In the case of going up a ladder, you can't bend the knee like you want, which makes it dangerous as hell climbing up a ladder. And you have to kind of compensate in the hip. So you get a different type of pattern that's going on in the hip that will affect the rest of the body. So you see how if we don't address what's going on in the knee, how it has compensatory issues that develop in other areas of the body. So that's what happens. If you try to strengthen your leg, which means push through this range of motion that already hurts, you're already perpetuating a dysfunctional tension pattern that has gotten set up in the knee. Pushing through the pain will never get you out of pain when you start off in pain. It's a good one. Okay, we got some questions that's starting to come in. Struggling with scar tissue after knee replacement surgery 3 years ago. Thanks, Linda. It's not exactly a question. However, if there is, yes. If you do have a question, please enter those, type that in as far as around that. I mean, it's common. Scar tissue forms after knee replacement surgery. They saw off the bones in your leg and replace it with plastic and metal. It's a trauma to the body. It was a trauma that you went up to the point of having that surgery, and then the body's going to form scar tissue to protect itself. It's a normal, natural response to when the body experiences something like that. So the idea is to begin to create comfort, change the neurology in the knee, and then we're having a different conversation on the other side of that. Okay, so that was Mary's from YouTube. This is from YouTube as well. This is from Free God MC. Thank you, brother. I've been watching all of your videos all day right now. I am in unquantifiable amount of pain, can't sleep for shit, and these pills are making me skinny. They gave me Bactrim last week because after the staples were removed, I got infected and there was oozing and blood and stuff coming out of the knee. I was scared, but I FaceTimed a random ortho surgeon. He said, try to elevate it lots in water, keep taking the antibiotics. It stopped this morning, so I didn't go to the ER. I'm going to send you pictures on my Instagram. Thank you for visually listening to me. Absolutely. Let's see. Okay. That period right after a knee surgery, doesn't matter if it's just arthroscopic, if it was a surgery like mine, ACL reconstruction, they took out meniscus, or if you have a knee replacement surgery, that period right after the surgery is a very challenging time. There is the only way that I've seen to move through that space faster. And of course, hindsight is 2020. What I know now, I wish I would have known 21 years ago, and would have significantly made adjustments up to the surgery, which would allow me to heal faster after the surgery. A big part of it is knowing those things, the environment that you're creating for yourself after the, or before, during, and after the surgery. After the surgery, especially when you're on pain medication, or I was on Percocet, it was making me vomit. That's not the time to kind of figure out your strategy, how you're going to get out of pain. A little bit like shutting the barn door after the horse has already run out. So, proper preemptive planning prevents poor performance. And what I see many times is there isn't the foresight as to what's going to happen after the surgery and that painful period. And a lot of times your friends, family, loved ones, whoever supporting you in that process is only going to go by what the doctor or the physical therapist says. And that may or may not be in alignment with you. Understand that the doctors and the physical therapists are great for when something is broken or torn, setting up those conditions or that environment for you to heal afterwards the fastest. I'd take my chances on my own. The point of it is that doctors aren't educated in nutrition. Doctors aren't really educated as far as supplementation or other things, holistic or natural approaches to relieving pain in the body without it being a prescription drugs. And then you have a whole host of other issues as to how the side effects and how it affects the body, aside from, like I dealt with, making me vomit. So anyhow, it's something to think about and consider. But as far as sending me pictures, there isn't a whole lot I can do with the pictures. I can see what's been going on with your knee. However, the paradigm I look through to get you out of pain the fastest is to hear what hurts the most with your knee right now, and then show you how to create comfort in your knee right now, which will move you out of pain and begin to unwind the tension in your neurology, so we have a different conversation next time. It's simple. We're looking at simple. I didn't say easy. It's simple in terms of creating comfort and setting up the conditions so your body moves to healing much easier. So, okay. Next question here is from YouTube. It says, from BCW, quick question, man. No knee pain question is a quick question. Inside of my knee after an injury to it is swollen. It did not swell up on the inside until a month later, and it's just painful now. Everything is healed. Was purple, fell through gap on a red iron bridge, and I bumped it a few times in the last week. The MCL inside of left knee is swollen now. It's hard. What do you recommend without a doctor? I can squat down, not just raise the knee up to walk on a step ladder. That's not my area of expertise. Ultimately, everybody who has experienced a knee injury, it's essentially important to get a doctor's diagnosis. This way you know what you're dealing with. Like, learn from Bill the mistakes I made so you don't have to. I dislocated my left knee 4 times before I went to the doctor. If I would have went to the doctor after the first knee dislocation, there's a good chance I could have avoided having the ACL reconstruction, the ligament reconstruction on my left knee. It's a big thing, and I know people want to go on the internet and figure out what is going on with their knee without having to go to the doctor, but there still is a reality of where we're at right now in this world where a doctor is crucial and essential to understand what we're dealing with. Because if something is broken or torn in your knee, the strategy for getting you out of pain is significantly different than if nothing is broken or torn in the knee. And without knowing that, we're kind of grasping at straws. So, with that being said, we can create comfort in the knee, and we can see what happens in the neurology. And if the pain completely goes away, then we know nothing was broken or torn in the knee. However, it's a little bit of a guessing game to that point. So if the pain comes back, we don't know if the pain's coming back because something was broken or torn, or it's the healing process that your body's going through. So there's already self-doubt in what's going on with the knee, and we're just adding to it without having a diagnosis. Okay, next question is from Dairius Fairchild. Let's see, he sent in a couple of them. Thank you for your reply. This is just going on too long. They told me 2 to 3 weeks of therapy after surgery, which took 2 months. To have that, I would be back to work now. They keep changing my return date. He also says the procedure was arthroscopy with debridement and chondroplasty to extend the life of the knee 5 to 10 years before replacement. Because of my age, I am not old enough to have it and would have to be replaced again in 20 years per the doctor. Yes, and that's how it works. They want to wait. They want to allow you to suffer long enough to get old enough to finally cut off the bones in your leg and replace it with plastic and metal, in the hopes that you'll die within 15 to 20 years so they don't have to replace the knee joint again. Now, if that makes sense to you, I'm not your guy. I am absolutely not your guy, because I have the belief that the body has the infinite capacity to heal itself. And the only reason anybody would go to the doctor and request any sort of surgery like that is because there's pain in the joint or there's limited range of motion. And if we get your knee out of pain and you have limited range of motion, do you care what your diagnosis is? Would you go to the doctor? If you say yes, well, then I'm not your guy. If you say no, then I'm going to go on to Dairius's next response was, let's see what we got here. He repeats it was an arthroscopic with debridement and chondroplasty because of the missing cartilage at the end of the femur at the weight-bearing point of the knee. This procedure was done to extend the life of the knee 10 to 15 years, then replace the knee. Should I just have it replaced? So if he's asking me if I should have it replaced, it's almost as if Dairius didn't even listen to my last video. Almost. Matter of fact, it sounds just like that. Because if that's your mentality that you want to have your knee replaced, then ask your doctor that question. I'm not your guy. Natural solutions. The body has the capacity to heal itself. The only reason you're going to the doctor is because of pain or lack of range of motion. If we can, and I believe the body can, if you do simple things each day to set up the conditions to relieve the pain by getting the pressure off of the nerves, rewire the neurology, and set up the conditions in your life so your body can heal, because to this point it hasn't been healing. Then in another week, another month, another few months down the road, we're having a very different conversation. You don't feel so overwhelmed by what's happening in your knee, and you're empowered with the knowledge and understanding of how to get your knee out of pain if the pain happens. So, Dairius, I've been through this a lot of times, and there were people that will listen to these videos over and over again, and they'll still ask me questions from an old mindset, an outdated mindset that is looking at either drugs, shots, surgery, or painful physical therapy to provide the solution. In that case, if you aren't able to hear me for whatever that reason is, Dairius or anybody else, then go to the doctor. I'm not your guy. Anyhow, if you got questions, please enter those in the comments section. If you like the video, give it a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel, and turn on notifications for future videos as I do these several times per week. I got the fancy little intro, and I got an outro for you too. Okay, that's Dairius. Okay, here's a question from Brian. This came in yesterday. I had the challenge with getting the video up and going. It says, I am now post 18 months after having bilateral knee replacements. Bilateral means he did both of them at the same time. If you're going to be a bear, be a grizzly, I suppose. Still getting a lot of pain behind the patellas. Patellas are your kneecaps. So that's right behind the kneecaps, which the surgeon left, which means they didn't replace the kneecaps. He got to keep the kneecaps he was born with. Appreciate your comments. All pain is caused by nerve irritation. And by getting the pressure off of the nerves in the knee, you begin to create relief. The joint relaxes and expands, which gets the pressure off of the nerves. It begins to set up the conditions so your body is able to heal, even if you've had a knee replacement. Now, to the degree at which we'll be able to get a knee out of pain after a knee replacement surgery is, once again, it's a little bit of a hit or miss. I've had clients that have relieved the pain. They've increased the range of motion as a result post knee replacement. It's one of those things. You got to determine as to what you're committed to. That's a big thing. Are you committed to continuing? Because the doctor, what they're going to do is say, well, I'm sure. No, I can't say that. I don't know what the surgeon would propose if the pain behind the knee doesn't resolve itself, behind the patella. However, understand their business model or understand the paradigm that they function in. It involves drugs, shots, more surgery, or painful physical therapy. That's what you want. You know what to expect. It's not all that big of a surprise. You want to work with and understand how your body's capable of healing itself. Then you might want to check out KneeClub. KneeClub is my coaching program, group coaching program. Let's see. We got the Knee Pain Guru. Here we go. So, if you like the video, give it a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel. You can share this video with your friends, especially those that limp. They're easy to spot. And if you want to know what to do on the other side of this, like you're hearing this information, this is great stuff, cool, head on over to, there we go, the kneepainguru.com website. There's a video on that page, which you could check out, that gives you more about my approach, creating comfort in the knee, changing the neurology so the body is able to heal itself. And then ideally, you'd sign up for my KneeClub program. My KneeClub program is my group coaching program. We work twice a week, in a conference call, group conference call, and I give you the specific videos to watch and work on for homework on the specific area of the knee or whatever you're experiencing challenges with in your knee, whether it be pain or range of motion, numbness. You know what your knee feels like. That's why we have the calls, so I could figure it out too. Okay, we have some questions now. We're going to scoot on over to Facebook. What's up, baby? That's okay. That's okay. Try them again. Okay, here we go. So these were questions that were sent in by via my Facebook group, the Knee Pain Guru Facebook group. Okay. Oh, we got more questions. We can answer these too. Okay, here we go. Oh, some came in on Instagram because the Facebook is connected to Instagram. Okay, here we go. This was from Alex. I think I have a left knee injury with exercise and now it is swelling. Has limited flexibility and a pain level of about 4 to 6 out of 10. And I had Alex, I was like, okay, did you go to the doctor? Get that diagnosis so we know what we're dealing with. The big thing is to go to the doctor so we know what we're dealing with. That gives us a solid foundation to know how to move forward. Let's see. This is from Aaron. Okay, this was Aaron who his knee got wrecked. I don't know what happened, but he had a pretty severe knee injury, a lot of pins and screws that is holding his knee together, and he's in a lot of pain right now. He's trying to get the range of motion in his knee. And here's what happens with the range of motion. The range of motion locks when the joint doesn't feel safe. Right? Injury, pain. It tenses up to protect itself. The knee does. The rest of the body does. And to force the joint to bend when it's already neurologically tensed up to protect itself, you're working against it. You're working against a joint. You're working against your nervous system. This is the equivalent to driving around in your car with your foot on the gas and your foot on the brake at the same time. You're like, why is it so difficult to go forward? Well, because your foot's on the brake. But the doctors told me, or the physical therapist told me to step on the gas harder. So you step on the gas harder and now you smell all this smoke. Well, what's going on? Because your foot's still on the brake. This is what the neurology does when you can't get the range of motion that you want, that you can't walk the way you want. The tension is in your knee, and your hamstring, and your quad, and your hip, and your lower back, and it's difficult to sleep. And you're fatigued early and after you get up shortly because you haven't been able to sleep the night before, and now your body is struggling to move the next day. And yeah, sure, you can warm it up and it'll be relaxed for a little bit of time, then it goes back. That's because of the neurology. That's because the foot is still on the brake. It's a simple concept. Now, it's not necessarily easy. There's stuff we need to do. That concept. It's easy to understand why doubling down on painful physical therapy is not going to get you where you want to go. Got a comment that came in. Let's see. Wildflower 5586. Do you need a doctor's diagnosis before you advise on what to do? Thank you. Okay, good question. The doctor's I have clients in my coaching program that I work with. There's one woman in Africa right now. She's not going. The last time she had an MRI was 3 or 5 years ago, something like that. She knows she has a torn meniscus in her knee. She believes her body can heal it naturally. She understands that she has a torn meniscus. She understands that there's going to be a limited amount, not limited, we don't know what the results are going to be. I can offer guarantees with my program to get you out of pain as long as nothing is broken or torn in the knee. Is that making sense? Like, there's a legal piece to this that I'm not going to guarantee that we can completely get your knee out of pain if there's a ligament flapping around in there, or you fractured a bone in your leg or your kneecap, or you have a torn meniscus. You have to understand that there's a component where you need to take responsibility in this process. I can work with you. However, we don't know where that potentially can go. We may hit a glass ceiling where the knee doesn't get better if there's something broken or torn. So does that make sense there, Wildflower? Wildflower 5586. Is that making sense? Okay. So we got Aaron's question, Wildflower 5586's question. Now we're moving on to Gene. What did Gene write here? I'm 63 years and in good health. I take only supplements, vitamin C, fish oil, turmeric, MSM, chondroitin, multiples, and only occasional ibuprofen for headaches. My both knees are slightly swollen on the inside and only painful when I go up the stairs, which I have to do a lot. How much would a private consultation be, and what could you do to help? Now, and this will probably tie in with Wildflower 5586's question. Scheduling an appointment to talk to me is kind of a one-off, and I'm happy to talk to you, but it's basically helping you develop a strategy on how you're going to get out of pain, like a blueprint. I'm severely limited with a one-off as far as how I can help you. I don't look at the body as like a one-off, like I'm going to give you a series of exercises or stretches or supplements or whatever to get you out of pain. Because in order to understand the integrated nature of your body and its capacity to heal itself, I can't change one thing with 1,000 other variables that can happen, or your mindset or the emotions that come up or the environment that you're living in that will either make it successful or prevent you from being successful. A one-off is not going to get you there. So, Wildflower 556, 5586, and Gene Lipchin, I'm going to be limited. I could, give you a few things to do. However, it's not the format that I'm able to help you with. That's not how it is. That's why I've set up KneeClub. That's why I've set up a group coaching program that will provide you the support on an ongoing basis until you don't need me anymore. I don't want you to be dependent on me to get out of pain. I want to meet you where you're at initially, give you tools and skills that you develop along the way to get you out of pain. Because the conversations we can have on the other side of you being in pain are infinitely cooler than hearing you complain about your knee over and over again about the same stuff. That's boring and it's dull, and it's not something I'm interested in doing. However, I am interested in evolving you out of pain and developing a more a higher level of awareness of what your body is capable of, that most people dump it off as being, well, that's just what happens when you get older. That's just what happens because I had a knee injury when I was a teenager, in high school, or in my 20s or 30s or 40s, or name whatever it is. Or this is just what happens when I get older and I'm going to have to hang out in pain long enough to get a knee replacement. You know how pathetic that sounds? Like, if we zoom out and what we're capable of as humans, and we're only having that level of conversation, we've let the bar get so low. It's pitiful. It really is pitiful. And the medical model, they have no financial incentive to give you anything other than what they already do. It's a successful business model. And it's until people like yourself that are suffering in pain begin to take ownership of their own healing process, so they understand how to get themselves out of pain. Well, the medical model, that they're learning how to make knee replacements in outpatient surgery. $49,500 per knee. That's a hell of a business model. I do not have that. And that's okay. I don't want that. Is it making sense? Got questions? Give the video a thumbs up. Like and subscribe to the channel. Turn on notifications for future videos. Send this video to your friends, family, and loved ones that limp. So, Gene, hope that answers your question. An appointment is going to give you a snapshot of the direction that you could go. And what I will do in that appointment, we can map it out. I had a friend. She reached out several months ago. She knew she tore the meniscus in her knee. No, she didn't know. She had knee pain and she was having these issues with the knee locking up. And we mapped out a strategy of what she needed to do to find out the information to know how to move forward. She found out the meniscus was torn. She went for an arthroscopic surgery, and she got out. She's doing great. The point of it is, when you don't know how to strategize that, and you're kind of in a place of fear, and you don't know how, do I go to a doctor? Do I not go to a doctor? How do I figure this out? I'm more than happy to talk about that with you, and what to do at what point. Because you can have an arthroscopic surgery and get the meniscus taken care of, and you could be in more pain after the arthroscopic surgery than before. Study done by the medical model around the placebo effect with an arthroscopic knee surgery. They did a number of people where they just put a hole in the skin, and other people they actually did the surgery on. They couldn't really tell. So you don't know what's going to happen on the other side of the surgery. So in that case, you may want an integrated approach. You're going to physical therapy. The knee surgery didn't necessarily get you out of pain. It fixed what was broken or torn, but it didn't get you out of pain. And then you're going to physical therapy, which is putting you in more pain. What do? Double down on pain? It's not going to get you out of pain. My point being is, we can map that out for you as to what you want to do, and at what point. Do you want to do the medical model? Do you want to do a natural approach, or do you want to integrate the two, which are totally doable? That's what the appointments are for. And I will offer you the chance to join KneeClub, my group coaching program. And that will give you the tools you need to get yourself out of pain. Okay, so that's Jean. We got a Jody. All she typed in was get started. Not a whole lot I could do with that. Anyways, any questions, put those in the comments section. Let's see what we got here. So there is a knee pain. Okay, that is, where did I go? Yep, so that's the URL you can go to if you want to look at what KneeClub looks like. We have calls on Mondays, 1:30 p.m. Eastern Time, Thursdays, 5 p.m. Eastern Time, Mondays, Thursdays. There's a private Facebook group. You ask questions. If you can't make the calls for whatever reason, I answer the questions in the call. The calls are recorded. You can watch the replay. It's a way to save time. I have private coaching if you're interested in that as well. If you just want to work with me one-on-one, up to you. Okay. Those are all the questions that catches us up as of Wednesday, October 28th. You don't have to suffer with knee pain, but hang on there because I got a really cool, I worked on this video. My daughter picked out the music. So check it out. Thank you for being here. Have a great day. You have questions, type those in the comments section. I read all the comments, reply to them, or use them in future videos. Have a great one. Bill Paravano, the Knee Pain Guru, signing off for today.